Good evening, Taz. That's right. Some experts are saying that we haven't seen a corresponding increase in hospitalizations, and that's what we should be monitoring for. So they aren't too worried. Same with some people who are getting ready for Christmas today. The rise in cases today didn't really influence many people to change their plans because they already set up small gatherings.
Just my family. I mean, we don't want to gather in too big of groups.
I didn't. They were pretty casual to begin with.
I did have my one daughter coming from Montreal, but she's turned around and gone back home.
Infectious disease doctor Martha Fulford isn't alarmed by the numbers.
If we look at our ICU numbers, and that's probably the best reflection, they are completely flat. We are not seeing an increase, and this is good. I would say that right now what we actually have is a pandemic of positive PCR results. What we most certainly do not have is a pandemic of sick people. And I actually think this is an incredibly important message we need to start to get out.
Epidemiologist Timothy Sly says he's cautiously optimistic.
The virus is in its out of control phase. It's going through the population very rapidly, almost like a forest fire. So it's already been about 3 weeks. And we're not seeing that great surge in hospitals so far.
But he also adds that it could take a little longer to reflect in the hospital numbers.
The whole thing can take about 5 weeks or so. So there's always that lag time between the new cases appearing today and how many of them will end up in a serious way later on.
But even then, Fulford says the way the hospital numbers are reported should be changed.
A great many of them are incidental. So if you are admitted to hospital because you've been in a car accident and we screen you and you test positive, you end up being a COVID case, even though you're asymptomatic from COVID.
Both of them say vaccines are the best protection. Premier Doug Ford toured a new mass vaccination clinic at the International Center in Mississauga today.
Because of these great frontline healthcare workers, we're able to ramp up and do 19,000 doses a day.
But in Hamilton, some experts are speaking out about the city's vaccination efforts. A Hamilton doctor is sounding the alarm about mass vaccination clinics not being used to their full potential and that the city needs to do better.
We could be vaccinating many more people than we are in these public health-led vaccine clinics.
Jill Witcheruk works at vaccine clinics to administer COVID-19 shots. But 3 days ago, she didn't have that many people come in, and she's frustrated.
I was at a public health-led vaccine clinic for 3.5 hours, and I gave likely under 20 vaccines.
She says public health should start allowing walk-ins for boosters at city-run clinics.
The primary care-led clinics that I've been at that have walk-ins, I was busy the entire clinic.
Witcheruk says the city should start allowing walk-ins for booster shots because the healthcare workers are ready to administer the vaccine, but enough people aren't coming through because of the strict rules in place. But in a statement, Hamilton Public Health says through consultation and experience, they've determined that appointments are more effective than walk-ins. Back to you, Taz.